sister, and I've been in post for about a year. So before this job, I was a nurse manager in a GP practice, and I've been registered for about 20 odd years. And before primary care, I worked in loads of different areas, mainly sexual health, HIV services, but also spent some time working on the wards as well, and then as a district nurse. So today's topic, we're going to be talking about breast health, and it's just a brief overview. So if you have any questions, I prefer to leave until the end. And I've got to get my kids from school at 3:15. So if you can finish for about 3:05, that'd be brilliant as well. But I should imagine it'll be about 40 minutes, this webinar. Okay, so bear with me. Right, let's get the ball rolling. So the breast generally refers to the front of the chest, and this is medically specific. This is medically specifically refers to the mammary gland. So the word mammary comes from the word mama, and that's the Greek and Latin word for the breast, which derives from the cry from mama uttered by infants and from young children as well, and sometimes meaning I want to feed at the breasts. So female breasts can produce milk for breastfeeding, and they also serve as erogenous zones or pleasure zones. Males also have breasts, but they don't serve the same purpose, but they do have that erogenous zone feature as well. So the primary function of the female breast is to produce milk via a process called lactation. And the milk provides infants with the nutrition, and this helps to feed them and boost their immunity as well. Structurally, the breast consists of a number of lobes connected by kind of the milk carrying ducts to the nipple, and each lobe is a compound gland branching into kind of the lobules and the alveoli, and this lines with the epithelial cells that supported the loose matrix of the connective tissues. And these connected tissues includes the accumulation of the adipocytes or the fat cells. So during pregnancy, the duct system and the ovuli expand considerably as the epithelial cells that line the alveoli are responsible for the milk secretion. And at the same time, the connective tissue is reduced as well. So the alveoli are surrounded by the contrail cells, or the microcytes, which put pressure on the alveoli to promote milk secretion. So after weaning, when breast milk is no longer required, the alveoli regresses, leaving just the duct system in place. So in addition to the primary function of providing nutrients in infants, breasts also have a social and sexual kind of prominence as well. And these structures are often considered as a measure of sexual attractiveness in women. So when we think about most issues, most common breast problems, breast cancer is up there as number one probably. So there are several different types of breast cancer which can be diagnosed at different stages and can grow at different rates. So you have your invasive and non-invasive breast cancer, and this accounts for something like 70 to 80% of breast cancer cases. So invasive breast cancer has a potential to spread to other parts of the body, or you have your non-invasive breast cancer, and non-invasive breast cancer has not developed or has the ability to spread and either within the breast or to another part of the body. Other types of breast cancer could be your ductal carcinoma in situ, or DCIS, and that's an early type of breast cancer. And these cells are usually found inside the milk ducts and usually known as in situ. This type of cancer has not yet spread to other parts of the breast tissue or to other parts of the body. You can also get something called inflammatory breast cancer, and this is a rare type of fast-growing type of cancer. It's called inflammatory breast cancer because the skin on the breast looks red and inflamed, and this is caused by breast cancer cells blocking the tiny lymph channels at the breast and in the skin. Other types of uncommon cancer that's a type of breast cancer is the triple negative breast cancer. As I say, this is a relatively uncommon form of cancer, and it's usually more aggressive and is harder to treat than other types of breast cancer as well. Something like 15% of breast cancer cases are this triple negative cancer, sorry, and there's something like over 8,000 cases a year in the UK which are triple negative. It's known as the triple negative because it lacks all the three molecules called receptors, and other types of breast cancer have known to have at least one of the three receptors. So you've got your estrogen receptors, your progesterone receptors, or your human epidermal growth factor receptor. You can also get other non-cancer related conditions. A common kind of condition is something called mastitis, and this is a really painful inflammatory condition of the breasts. Something like 30% of women who are lactating or breastfeeding will develop mastitis, and it usually happens 2 to 3 weeks after baby is born as well. You can also get non-lactational mastitis, so in women who have not breastfeeding, but they can get that painful inflammatory condition, but that's quite rare. That's something 5 to 9% of women will can get that, and that's most common in people who are of reproductive age as well. And mastitis is most commonly unilateral, so you only have it on either one boob or the other. Other complications of mastitis can be a breast abscess, and that can occur up to 10% of women with mastitis will develop a breast abscess. A breast abscess is a localized collection of pus occurring in the breasts, and with that you get lactational mastitis, and that happens due to the milk stasis is reduced due to breastfeeding. So that can happen because you have changes in the kind of feeding regime when you're feeding baby. You might have introduced baby to the bottle. It could be that the infant's got a poor attachment or a poor latch. It could be that because mum's under stress and feeling tired and fatigued and tired all the time as well, which is quite normal with a baby. Other issues surrounding breast can be breast engorgement, and that usually happens in the first day postpartum, so a few days after baby's been born, and that's usually both sides, and with that you get that tender, painful, swollen breast, and that usually when your breast milk comes in as well. Other types of breast problems can be the gallo-tocele, and this is a smooth, round, plainless swelling. But with it, you feel really poorly. You get systemic features of feeling like you've got fever, malaise as well. Or you can get fat necrosis of breasts. And this presents as a firm lump with bruised skin. And this is usually associated if you have a history of trauma, but you don't get any kind of systemic features of infection. So, and it usually kind of resolves itself as well, is a spontaneous, it resolves spontaneously. So breast cancer is the most common form of cancer in the UK. Approximately something like 55,000 women are diagnosed with breast cancer in the UK every year. It's the most common form of cancer in women aged 50 and over. And every year, unfortunately, something like 11,500 women will die from breast cancer, and 85 men will die as well in the UK. About 1 in 7 women will be diagnosed with breast cancer during their life. And the most common noticeable features of breast cancer is a lump or thickening of the tissue. But some forms of breast cancer can actually be prevented as well. So I'll be talking quite in depth about that in slides later on. So there are some things that you can't do to prevent breast cancer. We're all aging as the population ages. You know, statistically, 1 in 2 of us will have breast or some type of cancer in our life, and that's because the population is getting older, and that includes breast cancer as well. Being female or having high exposure to hormones or estrogen increases your breast cancer risk as well. If you have a family history of breast cancer, such as the BRCA1, BRCA2 gene mutations, this can increase your risk of breast cancer as well. So for those who are taller, that's been linked to having, or if you have a tall stature, that's been linked to having higher levels of growth hormone. If you're heavy at birth, if you have your heavy birth weight, that's also have a higher level of growth hormone as well. So we know that that can be linked to high incidence of breast cancer. For women who start their periods at quite a young age, we know that you have higher lifetime exposure to estrogen. And any kind of prior diagnosis of breast cancer or certain types of breast cancer disease as well can also make you a bit more higher risk. And there's these things that you can't prevent. For those women who have bigger boobs naturally, so they have higher breast density and they have less fat tissue and more fibrous or glandular tissue as well. And also older people at menopause are linked to higher incidence of breast cancer as well, because you have a higher an exposure to estrogen. So there's a video here about what you can do to reduce the risk of breast cancer. Let me just see if the video will work.
Este tema se lo quiero dedicar a mi buen amigo Don Juan Purga. ¡Vamos ya, pelate!
Breast cancer rates are rising, and although uncommon, men can get breast cancer too. But there are so many ways you can reduce your risk, and it doesn't have to be difficult. So, here are our top tips. Eat plenty of fresh fruit and veg, and if possible, buy organic. Be drink aware, and have a few alcohol-free days a week. Exercise, have fun, and sweat it out any way you like. Try to reduce your exposure to potentially harmful chemicals. These can be found in everyday products. Always check ingredients lists and avoid products that contain parabens, triclosan and diethyl phthalate. Avoid plastic packaging, which may contain bisphenol A and phthalates. Source alternatives. Ditch the junk. Sadly, we can't prevent all breast cancers, but if we make the right choices, we can reduce our risk. So, get informed and take action. Find out more. Visit breastcanceruk.org.uk.
Hello. So I think that's about it. It's just some people dancing now. It's quite nice to see that, isn't it?
I'm watching a video here in the background and we're going to the kitchen.
So those are kind of the take-home measures you can take. So eat plenty of fruit and veg, be drink aware with alcohol-free days, maximum 14 units a week. Exercise, 150 minutes of exercise a week. They say it's the Department of Health kind of guidance, which is about 30 minutes over 30 minutes over 5 days, and reduce exposure to kind of harmful chemicals, especially those you find in cleaning products and stuff as well, and stop smoking and keep your weight within a healthy BMI. So let me just go on to the next. So
You've had mute.
Linnaeus, you're just on mute there. Hi, Linnaeus, you're just on mute.
Linnaeus, you're on mute.
Am I back in? Sorry.
That's
Sorry.
right.
Let me get back onto my slide deck. So we have symptoms of breast cancer next. So what are the signs and symptoms? So the first symptom of breast cancer most people notice is a lump in their breast or some thickening. Most breast lumps are not cancer. Lumps that aren't cancer are called benign lumps. Most benign lumps are area of normal lumpiness, and this is usually more obvious just before a period. You have your cysts, and these are little sacs of fluid that that are in the breast tissue, which are quite common as well. Or you've got something they call fibroadenoma. Sorry, fibroadenoma. Fibroadenoma. I always have to practice that. And this is a collection of fibrous glandular tissue, which is more common in women under the age of 40. So to recap, some signs and symptoms of breast cancer is a lump or thickening in the breast or the armpit, a change in size, shape or feel of your breasts. So think about your oranges and lemons as well. So your oranges says skin changes in the breast. So your anything that looks like orange peel really. So it could be a puckering, dimpling, a rash or redness of the skin. Sometimes you might get some fluid that leaks from the nipple as well. And that's when you're not pregnant or breastfeeding as well. Or sometimes you can also get changes in your position of the nipple as well. It can become introverted rather than being extroverted. So it's always important to get any kind of breast lumps checked out by your GP, and they'll arrange you to have some tests as well. And they'll let you know if your lump is cancer or not. There's another video here. Then this is from Copperfield. Copperfield's a really, really good charity. And I'll just see if that, hopefully you'll get the sound of this on how to check your boobs.
There are no rules for boob checking. Just do whatever feels comfortable. The key is getting to know what normal feels like for you. All you need are your hands, your boobs, and some handy pointers. You can check anywhere, in the shower, on the sofa, even when you're getting dressed. Just make it part of your normal routine. Everybody has breast tissue, all genders, so we should all be checking. You spend more time with your body than anyone else, so you're the best person to know how your boobs usually feel. All boobs are different, and they'll naturally change throughout your life, even each month, so get to know their natural rhythm. Note anything that changes or seems unusual. If one area feels thicker or any new lumps appear, or if you notice a sudden change in size or shape. It's normal for boobs to hurt around your period, but if the pain is different or there more often, then get it checked out. Keep an eye out for changes to the skin, like dimpling or puckering, or any unexplained rashes or redness. And don't forget your nipples. Look to see if they've become pulled in, moved position, or changed shape, or if there's any crusting or liquid coming out. Make sure you're feeling everywhere there's breast tissue, not just your boobs, but right up to your collarbone and under your armpits too, in case there's any swelling. We recommend copping a feel once a month. And if you notice anything that doesn't feel normal, monitor it for a week and book an appointment with your doctor. Sign up for our handy reminders so you remember to check.
So whatever your age or gender, knowing your body and being aware of the symptoms of breast cancer is really, really important. If found early, breast cancer is very treatable and the survival rates are much higher as well. So get to know what's normal for you and check yourself regularly. I always tell people to check themselves on payday because it's something that sticks on your brain, isn't it? On the 25th of every month, I check my boobs. So I found that useful, that video really useful, just because it's a good little insight on how to do it as well. So, So your body is made up of little tiny building blocks, and these are called cells. And inside each cell, you have something called genes. And these genes give instructions to the cell to work properly. BRCA1 and BRCA2 are two different types of genes. And everyone has BRCA1 and BRCA2 genes, but if the gene is changed and it might not give the correct instructions anymore, and this can cause this is called a gene variant or a mutation. So your BRCA1 and BRCA2 genes usually protect us from cancer, but a variant in either of these genes reduces this level of protection, and over time, this might mean that some types of cancer are more likely to develop. So the risk is highest for breast cancer in women or people who are assigned female at birth. BRCA genes run in families, and genes are passed on from parent to child, and that's through conception. A woman or a person who is assigned female at birth, who inherits a BRCA1 or BRCA2 variant has a higher risk of breast cancer or ovarian cancer as well. And they have a 50% chance of passing that gene variant or that BRCA2 variant onto each of their children as well. But remember, you don't have to inherit the BRCA1 or BRCA2 variant if you don't inherit the BRCA1 or BRCA2 variants, you cannot pass that on to your children. Not everyone with BRCA1 or BRCA2 variant will have a history of cancer in the family, but a gene variant is more likely if there's a pattern of cancer in the family. So you can actually get genetic counselling for this, and you have to fit a criteria. So you can be offered a blood test to check if you have the BRCA1, BRCA2 gene variants, if you have breast cancer at an unusually young age, if you have certain types of breast cancer, so going back to those triple negative breast cancer, and that's usually when it's been diagnosed at an early age, only something like 15% of breast cancer cases are that triple negative breast cancer. If you have a certain type of ovarian cancer, such as the high-grade serous ovarian cancer, or if you've got a strong family history of cancer that suggests either BRCA1 or BRCA2 variant is likely, or if you have a relative who actually is a carrier of the BRCA1, BRCA2 variant themselves, then you can go along to your GP, ask for a blood test, and be referred to the genetic counsellor for that. So there's lots of confusion surrounding HRT and breast cancer as well. So I just wanted to touch upon this really. So HRT stands for hormone replacement therapy, and this is an umbrella term for hormonal treatments that work to relieve the symptoms of perimenopause and menopause. HRT replaces the missing hormones that decline in the years surrounding menopause, and these low levels of hormones can cause things like night sweats, hot flushes, anxiety, mood changes, vaginal dryness, brain fog. For the vast majority of women, the benefits of taking HRT greatly outweigh any kind of risks, and the risks of HRT depend on the type of that you're given and other factors such as your general health and your age. So many women worry about breast cancer when taking HRT, but most types of HRT do not actually increase the risk of breast cancer. So some studies have shown that women taking the combined HRT, and that's those containing estrogen and progesterone, which is the synthetic type of progesterone, and that may be increased when that's associated with the increased risk that is related to the type of progesterone that is in the HRT and not the estrogen. However, there is no strong evidence that having a family history of breast cancer puts you at higher risk of getting breast cancer if you take HRT compared to a very small amount of increased risk of breast cancer in women who do not have any history of breast cancer or family history of breast cancer. So there is some evidence that women with a family history of breast cancer who take HRT actually have a lower future risk of developing breast cancer compared to women not taking HRT. And that means that women with a family history of breast cancer, including those women with the BRCA gene, can usually take HRT safely. So my take-home message is that from this poster especially, so this poster was created by the British Menopause Society, and you are more likely to develop breast cancer if you drink a couple of glasses of wine a night, if you're a current smoker, if your BMI is greater than 30, and these are all kind of lifestyle factors that you can address as a person, and these are changes you can make as well. So to prevent breast cancer, we have the breast screening kind of program in place in the UK. So breast screening uses a breast X-ray, and that's called a mammogram. And this looks for any kind of cancer that might be too small to feel or to see. So we all know that the sooner the breast cancer is diagnosed, the more effective treatment is likely to be. And screening can pick up breast cancer before there are any kind of signs or symptoms of breast cancer as well. So if you're aged between from 50 up to your 71st birthday, you'll be automatically invited for breast screening through your GP practice, and that's done every 3 years. And this is part of the National Breast Screenings Programme. you might not, this might not happen on the year that you turn 50, but it will happen by the time that you turn 53. So you have to be registered with a GP to be automatically invited to screening, and some trans or non-binary people can access breast screening as well, but you need to be registered as a female with your GP practice to be automatically invited for screening. So regular breast screening is one of the best ways to spot a cancer that is too small to see or feel. Breast screening saves approximately 1,300 lives every year. We know that finding cancer early can make cancer more easy to treat, and more likely the treatment will be more successful. You're less likely to need things like a mastectomy or breast removal, and you're more likely to be cured as well. And you can have breast screening, whatever size or shape your breasts are. So if you have breast cancer, you'll be assigned a multidisciplinary team or an MDT, which is a group of specialists who will work together to provide the best treatment and care for you. So when deciding what treatment is best for you, doctors will consider the stage and grade of your cancer, how big it is and how far it spreads. They'll also want to know about your general health, any past medical conditions, what medication you're taking. They'll want to know if you've experienced the menopause. So the first line of cancer is surgery. So the best way to treat any type of cancer is to cut it out. Surgery, and this type of surgery will depend on the type of breast cancer that you have. Surgery is usually followed by things like chemotherapy and radiotherapy, or in some cases you might get like hormone or target related therapies as well. So radiotherapy usually uses controlled doses of radiation to kill the cancer cells, and it's usually given after surgery, and chemotherapy to kill any kind of remaining cancer cells. It's a bit like a mop, it just cleans up any kind of cancer cells that might have gone a bit rogue. If you need radiotherapy, your treatment will begin about a month after your surgery or chemotherapy to give your body a chance to recover, and that's just so your immune system can recover a bit, so you're not completely immunocompromised as well. Things like chemotherapy, and that's a cancer treatment where medicine is used to kill cancer, and this can be given in lots of different ways. It can be given as an oral tablet, an IV intravenous drug, or sometimes it could be an injection as well. And they will stop cancer cells from reproducing, which prevents them from growing and spreading into other parts of the body as well. Some breast cancers are stimulated to grow by hormones, estrogen and progesterone, which are found naturally in the body, and these are known as hormone receptor positive cancers. So that's where you might get a bit unstuck about accessing HRT if you have a type of cancer that is a hormone receptor positive cancer. So that's why it's important to know what type of cancer that you have, and they'll measure it and they'll do biopsies and check to see what type of cancer you have. Hormone therapy levels. Hormone therapy lowers the levels of estrogen and progesterone hormones, and this will kind of put you into an early menopause as well. So you can also get treatments such as tamoxifen, and that stops the estrogen from binding to estrogen receptors, estrogen receptor positive cancer cells, and this is usually taken as a tablet or liquid. You've got other types of treatments like the aromatase inhibitors, and if you've experienced the menopause, you'll be offered these kind of types of inhibitors, and this blocks the aromatase, and that's the substance that produces estrogen after the menopause, and it's made by the ovaries as well. You've also got ovarian ablation or suppression, and this is for those who have not experienced the menopause just yet, or you have other things like targeted therapies as well, and this is kind of the newer type of breast cancer, and it's a brand name is known as Herceptin. I think that's about it. So I've whizzed through those slides quite quickly, so I don't know if there is any kind of questions that might have come up. Should we do you want to stop recording, Linda? Is that okay?
Yeah, I'm going to stop it now.
I'll just turn off my slide deck.